Well, hello again, everybody. Welcome into another installment of the Keep Boone Healthy Facebook information channel. I'm David Jackson, President and CEO of the Boone Area Chamber of Commerce. Another good news day here in vaccine land. Earlier today, Governor Roy Cooper and Secretary of the North Carolina Department of Health and Human Services, Dr. Mandy Cohen, made an announcement that we are moving forward with vaccination groups once again. The state will be making Group 3B available March 3rd. That is a full week earlier than we were originally told that transition would occur. And we also saw for the first time a date around Group 4, which includes those with some health condition issues, as well as other members of essential staffs that were not covered in this first wave of essential workers. So we'll get into some of those details here in a moment. What we thought would be helpful today is to pull our group of vaccine providers here into the mix and let them tell you how their individual agencies will be handling different parts of the Group 3B rollout. And again, this is frontline essential workers. There's a big long list that we're going to attach with this video in the comment section, so you can see what that looks like, so you can see if you fall into one of those categories. We had a lot of conversation last week about our local educators being a part of this initial Group 3 rollout. Now we're beginning to move into some of the other areas, such as restaurant workers, some of our agricultural workers, and a number of other areas. So we want to let you know kind of how our vaccine providers are handling that. So with us today, we've got Jen Greene from AppHealthCare. We have Sean Burroughs from Appalachian Regional Healthcare System, the Director of Pharmacy there. Alice Salthouse joining us from High Country Community Health, and Corey Furman with Boon Drug. So all of the folks that are helping to provide vaccines here in Watauga County able to join us on one call. And I can tell you behind the scenes, we put this together in about 10 minutes. Can't even believe that we got all these people together that fast. So without that, before you all drift away, let's start getting into this conversation. Jen, why don't we start with you? From AppHealthCare's perspective, what does this move into Group 3B mean, and how will you and your staff be implementing vaccine deployment?
Well, we're just excited to be moving ahead, as I'm sure all of us as vaccinating providers are. It's great to see us moving into a new group of people that we can help protect. So for us, we're going to be trying to organize in partnership with others on this call, some special clinics that we can target for some essential workers. We'll be offering those special times in addition to our normal vaccine schedule. So we're going to alter some of our clinic times to try to make it more accommodating for some essential workers. We are hopeful that we can certainly see more people get vaccinated quickly. And I think that's why we're all on this call and coordinating together.
Thank you very much, Jen. And I know that those of you chamber members that have restaurants, you've seen some communication come from, as the time of this video airing, from AppHealthCare, also kind of double back behind not only ourselves, but the Blowing Rock Chamber, as well as the Downtown Boone Business Association, just sending some communication to you all specifically. So be on the lookout for that if you haven't seen it already. Sean Burroughs from Appalachian Regional Healthcare System, how is the hospital handling this vaccine deployment in concert with the health department, but also working through your own patients as well?
Yeah, absolutely. I echo Jen's comments that we're very excited to be able to move on to the next phase and thrilled that it was moved up a week. I feel like we've done a good job collaborating the different providers here to be able to get through the previous phases. I did want to stress that those that are 65 and older, or even phase 1 folks that have not yet been vaccinated for whatever reason, are still eligible and prioritized to get vaccine now. So if there are any of those folks that are listening that feel like they want to get vaccinated and haven't been able to yet, now is the time. Just give either ARHS, Boon Drug, AppHealth a call, and we will certainly get an appointment in for those folks. But for the folks moving forward, it's always good news. It feels like we started with the trickle, and now more vaccines becoming available. There's different types of vaccines. So we're really making great progress through our community, being able to vaccinate them, and we're going to continue to do that together. And it has been key to be able to work together with all the folks on this call to be able to get through what we're able to get through so far and what we will in the future. As far as ARHS specifically, I don't even know that I can say that, because we've been in constant contact with AppHealth to collaborate on this, and with Alice and Corey, and we're going to continue to do that. So We have clinics at the rec center, just like AppHealth does, but everything that we've done so far has been in concert with the health department in our community, and we're hoping to continue to do that.
And I think that's a good point to make with you two specifically. You guys have kind of had the rec center set up working. It seemed to have worked well, people moving in and out of there. And we're going to get into some locations with our next two guests here, just to make sure that everybody knows where you can find the right vaccine partner at the right location. If you've got an appointment scheduled for one or the other, want to make sure you head to the right place. So with that said, we'll move on to Alice Salthouse with High Country Community Health. Alice, great to have you back. Tell us a bit about how your organization is going to play into this Group 3B deployment.
Well, it is exciting not to have to be restrictive, as restrictive as we have been, to make this open to a lot of people who are excited to get the vaccination, want to have it. I know that, I don't know if it's still up, but there was a sign at the hospital talking about healthcare heroes. Let me tell you, their staff, our staff, they are working hard to do their regular jobs, plus the testing that's still in place, and then the first dose, and then now the second dose. And now we're so excited about the Johnson & Johnson that's going to be in the county available. So High Country Community Health at 935 State Farm Road, we still have testing events, which is an important part of staying safe. So if you want to be tested, we are doing Tuesdays and Thursdays from noon to 5. All you have to do is call the number 828-262-3886 for testing, and we'll get to you. And then most every day we have vaccinations going on here at High Country Community Health. That same number you call to get an appointment, and you have to fill out the paperwork, and we'll do our best to get it for you if you qualify.
Excellent. And for those that don't know, haven't paid attention for a little while, remember High Country Community Health is located in the old Boone Urology building right there on State Farm Road. Beautiful facility, sign right on the front. So those of you that maybe used to the old facility, make sure that you make note right there at the top of Boone Heights Drive. You can get right to that, easy in and out. So thank you, Alice, for all your staff's work. We bring Corey Furman in next from Boon Drug. We've talked a lot about how Boon Drug has been such a supportive piece to this whole entire process through testing, through vaccine deployment, and now playing a little bit more active role in that as we move into Group 3B. Corey, tell us how your organization is going to be helpful in this rollout and this first real shot too of us not seeing a ton of subcategories within a state process. This is really a first now that we've moved into Group 3B.
Yeah, so to try and help with this larger group of people now coming in to be vaccinated, Boon Drug has a vaccination site at Mount Vernon Church where we can help out. It looks a lot like what they've got going at the rec center. We worked with them at their department to come in and tour and watch, and modeled it somewhat after how that's coming along, and it certainly didn't need to reinvent the wheel. So we use that as a model. Then by doing that, now we have an additional site in the area where as more vaccine starts coming into the county and they start sharing it with more and more providers, now Boon Drug has an additional site to be able to take care of that for people. So and Boon Drug's just honored to be a part of this group to watch what the health department and the hospital at High Country Community Health has already done. Our role has always been just simply supportive, to be able to come in and say, look, we've got this additional site, we've got these abilities to help to administer the vaccine, just feel free to use us. And we were just honored when they would call us up and say, yes, here, utilize some of this out at your site. So we've been able to do that at some of our locations as well. I remember our first one we did it up at Horn in the West, where we're doing our rapid COVID tests. But now we've got this location out at Mount Vernon, and very thankful for the relationship with them. So now as the vaccine becomes more and more available, now this provides an additional site to where the state will be sending the vaccine directly to Boon Drug for us to be able to administer at this site. And the nice thing about all the names and faces that you see on the screen here in front of you is that no one's really looking at this like, well, this is what Boon Drug is doing, and this is what the health department's doing. Everybody's done an excellent job to say, this is what we are doing. And so right before we got on the phone call, Spencer Hodges from Boon Drug and I were talking with Jen Greene, and we had a conversation about, what can we do to help share our resources in the coming weeks. So we still don't want to say that each of us are isolated from each other. We want to continue this relationship to be able to do the best we possibly can for the community.
Corey, if you can, because we have gone through this with Jen, I think the community can recite 3 W's, and I think they can also recite, go to fill out the vaccine interest form, and they know how to do that in some of these other locations. Can you tell us a little bit about how people can engage with Boon Drug now that you're into this in a little bit different way than you have been before?
That's right. So up until now, since Boon Drug was not officially the provider of the vaccine, we were simply offering our services as a resource, as a volunteer base. Now Boon Drug provides an additional spot for people to come on and register for the vaccine. And now that we've moved into this larger group, the manner in which Boon Drug is going to be doing that and providing this service is a little bit different than how it's been done so far with High Country and the hospital and the health department. So what we're going to be doing is, as vaccine becomes available at Boon Drug, we open up the boondrug.com website for the people in the community that are in the groups to come to the Boon Drug website and go ahead and pick a time and fill out the form. And so when you come to Boon Drug's website, what's a little bit uniquely different is that you're already registering for your vaccination time. So prior to this new release, it was much more important to say, hey, look, we want to make sure and we prioritize the people that are getting this vaccine. We must work within what the state's given us and make sure that those seniors are being vaccinated, those health responders are being vaccinated, and working down that line. Now that we're opening it up into a larger group, now people can come onto the Boon Drug website and say, yes, I am part of this group. They check off that box, and now they go ahead and get their time rather than waiting to be contacted and say, here's your time. It allows the person to come onto the Boon Drug website and pick their time. So I do want to preface this. A time is still required. Please don't just drive up to Mount Vernon Church and say, hey, I'm here to get my vaccine. You still need to log a time. Now, also, if you do come to Boon Drug and you get your vaccine, if you signed up at the health department or at High Country Community Health or at the hospital, and you're on that list waiting for a phone call from them, and you come to Boon Drug and get your shot, please contact them to have your name removed from their list, because we don't want them to have to waste their valuable resources and time keeping their list clean. Their job and energy needs to be devoted to making sure that everybody gets vaccinated, not looking back and calling you just to hear you say, oh, no, I already got my shot. I'm sorry, I should have told you that. So please do go ahead and contact them and let them know that so they can concentrate on taking care of the community.
Well said, Corey. Thank you for that information, and I know that will get quickly into the minds of everybody that's keeping all of this procedure stuff involved. But it is very much an all hands on deck type thing, not only to administer the shot, but the administrative back end behind this. And we've talked ad nauseum about that and how our local providers must get certain things into the state at certain times to keep the vaccination improvements that we've seen in terms of deployment occurring here in Watauga County. Saw a number that the governor communicated earlier today that vaccinations since late January have gone up 156% in the state in terms of allotments. So that's encouraging. We remember not all that long ago, this county was not receiving very much vaccine. And now that has turned, and largely because of how all of you all are operating within the state guidelines. So on behalf of county residents, thank you for doing what you're doing to make this as well-oiled of a machine as it is. And it's great to have more providers helping with that now. I want to close out by asking you, Jen, one more question and a point of clarification. So today in the announcement, in addition to Group 3B, which we're awfully excited about, we also saw, as I mentioned a moment ago, that timeline first communicated for what Group 4 is about. We've talked a lot about subdividing over the course of the last several months. And while we're not seeing as much subdivision in group 3 like we thought at one point in time we might, what do you foresee with group 4? Will there be any initial group of that group 4 categorization that may be opened up before the bulk of that crowd is able to come and get vaccines at any one of these providers?
Yeah, so what's exciting is that we're still talking about the same month that we're in, March 24th, which is not far from now, that we anticipate group 4 beginning. But really, we anticipate that first part of that will be for people with high risk medical conditions that are at higher risk for severe illness and death due to COVID. And that's anyone age 16 to 64 that has a high risk medical condition. And that's probably how we're going to start. And then afterwards, I think we'll be looking at other essential workers that haven't previously been covered by this current essential worker group that we are in. And I know it can be confusing. So, again, remember that we're here to help you if you have questions. And certainly, all of us are willing to help answer questions if you have them.
Well, there's some good guidelines that the state has put out, the Finding Your Shot tool that's available at the DHHS website. We've also put that at the Boone Chamber Recovery and Relaunch page, so you can go through that process and see where you're slotted. We've also got updated PDFs from the state that detail some of the groups, again, the essential groups that are available in 3B, as well as the essential groups beyond those with enhanced medical conditions that are available in group 4. So you can begin to look and see where your business happens to slot itself and begin to have those conversations with your employees. We've been able to distribute a lot of the vaccine information that these providers have been sending out for months now, redistributing that through the community so you can have those conversations about what types of vaccine are available, what the side effects are, how you schedule that out from a business perspective to make sure that you're also considering operational continuity while you get your staff taken care of as well. So a lot to digest. We realize that, but we are certainly grateful to the partners and providers that are listed here and that you see their face on these videos routinely for continuing to do such important work for our community. And what a difference a couple of weeks makes, right? I mean, there has been a lot positively happen in the last few weeks to get us moving in the right direction. And hopefully with everybody still practicing the 3 W's and doing what we need to do individually, we can keep the collective community still moving forward. So thank you all for joining us here today. And we look forward to talking to you again soon when you got more good news to share with us. Just call us anytime and we'll fire the Zoom machine up for you.
Thanks, David.
Thank you, David. Appreciate it.
Thank you so much.